This presentation on telehealth is brought to you by Amanda Perez, Ashley Jones, Maria Hubo, and Rachel Odoms from the Jacksonville University School of Nursing. The purpose of this presentation is to define telehealth, explain the different areas in which telehealth can be used, to contrast the pros and cons of telehealth, to review the cost of telehealth including reimbursement and potential savings, and to look forward to where telehealth may be headed in the future. What is telehealth? There are many definitions of telehealth. The American Telemedicine Association, the ATA, uses the terms telehealth and telemedicine interchangeably. The ATA defines telemedicine as the exchange of medical information from one site to another via electronic communication, such as two-way video, email, smartphone, wireless tools, or other forms of telecommunication technology to improve a patient's health status. There are different modes in which telehealth can be used. Real-time telehealth allows patients to connect to providers using a live connection, allowing for a real-time communication using video conferencing, telephone, or home health monitoring devices to mimic a face-to-face interaction. The store and forward telehealth feature is the transmission of data, images, sound, or video from one care site to another for evaluation. Examples of this include teleradiology and teledermatology. Images such as X-rays, CT scans, or pictures of skin conditions can be sent electronically to a radiologist or dermatologist respectively for analysis and interpretation when access to such specialties is limited. How can telehealth be used? Patients in rural communities have limited access to specialty providers. Telehealth can give patients in these communities the opportunity to benefit from such specialized care. Some telehealth companies offer services which connect hospitals with limited resources to other healthcare providers that offer specialized care. For example, eMersgency Services uses two-way video to connect rural emergency rooms to emergency-trained specialists and physicians 24 hours a day in order to provide support, consultation, or initiate physician-guided emergency care until a doctor can arrive on scene. Similarly, stroke patients in areas with no access to a neurologist can be connected using live video conferencing to a neurologist at a distant site to provide timely care and intervention. Telehealth helps to broaden the reach of healthcare and improve patient outcomes. Telehealth is also used in the home health setting. Many home health agencies, including the VA, are currently utilizing telehealth in the home environment. Patients are taught how to use equipment that records the patient's current status, like blood pressure, pulse, temperature, oxygen level, blood glucose, weight, and transmits that information to their healthcare provider for interpretation. This type of monitoring allows for early recognition of potential exacerbation of chronic conditions and allows for quick intervention. Early detection and intervention is key to preventing recurrent hospital admissions. The Veterans Administration, the VA, leads the way in technology for patients. With the VA telehealth system, patients with chronic disorders such as diabetes, CHF, COPD, depression, or post-traumatic stress disorder are discovering that treatment can be at times difficult and tiresome. In these instances, special devices are an invaluable asset because they make it possible to check on symptoms, measure vital signs, and allow the patient to become more actively involved in their medical care from the comfort of their own home. The use of telehealth has many benefits to both the patient and medical provider. Telehealth offers convenience. The goal of telehealth is to design a system that closely mimics a traditional doctor's visit. If you live in a secluded area and need medical care from a specialist who is located hours away, your local primary care doctor can communicate necessary information to the specialist so that you can get specialized care without having to travel long distances. Homebound patients can take their vital signs and instantly submit those readings to the hospital, clinic, or other designated location for analysis without having to leave the home. Patients with questions for their providers can simply send them an email or use video conferencing to communicate their concerns rather than waiting for an appointment. An electronic health record system also allows patients to access their health information on their cell phones, tablets, or other portable electronic devices. Telehealth also improves cost efficiency in many ways. Telehealth reduces travel expenses, which in many families is helpful, especially those in rural communities. An increasing number of doctors are also charging less for telemedicine consultations than they would for an in-person visit. The use of telehealth in the home health setting can also help manage chronic diseases better, therefore reducing the cost of hospital visits. Finally, telehealth offers around-the-clock support. Telehealth can increase the communication between the patient and healthcare provider, and tech support is available in case of a system malfunction. Despite the benefits of telehealth, it still has its downsides. Technology is one of the greatest inventions known to man. However, during a thunderstorm, power outage, or any activity that may cause a disruption in internet connection, patients would not be able to access their providers, subsequently causing the need to drive to an actual facility for care. Inaccurate assessment. Despite its conveniences, telehealth is limited in the area of physical assessment. You cannot physically touch a patient with telehealth systems, and this makes giving an accurate diagnosis of some diseases impossible. Physician resistance. Although many providers are adapting telehealth as their way of communicating with patients, not all providers feel the same. In fact, the bulk of resistance comes from doctors struggling to comfortably use new technology. Licensing issues. Most states require the physician to be licensed in the originating site's state. Consultation across state lines may require more paperwork. Potential for HIPAA violations. Online information can also be hacked, and the security of one's private healthcare information could be compromised. There may also be a limited amount of health information that one can transfer due to HIPAA regulations. Although ultimately cost-saving, the initial cost of setting up a reliable telehealth system could ultimately be transferred to patients. Currently, not all states and insurance providers offer coverage for telehealth services. Finally, older patients might not be as technology savvy when it comes to setting up and accessing an electronic account. The cost of telehealth. Not all costs of telehealth are reimbursed. Both Medicare and Medicaid have specific criteria that must be met for reimbursement. Medicare will only reimburse for telehealth in rural areas defined by the Census Bureau. The interaction between patient and provider must occur at a medical facility such as a hospital, clinic, or physician's office, and use live video conferencing with the patient present for the interaction. Medicaid does reimburse for some telehealth services in 43 states. Medicaid allows each individual state to decide what type of telehealth services will be covered. The use of remote technology is expected to reduce the amount of readmission rates and emergency room visits, which will therefore reduce Medicare and Medicaid expenses in the long run. The map shown details which states provide Medicaid coverage for some telehealth services, in addition to which states also offer some sort of private pay insurance coverage as well. The future of telehealth. The Affordable Care Act could mean that telehealth will be in higher demand in the future as millions of previously uninsured Americans will be entering into the healthcare system, making face-to-face appointments with a physician more challenging. As time goes on, the use of telehealth will expand, and more states will provide insurance coverage for those telehealth services. Technology advances will continue to improve, and current systems and increased access to rural communities will provide more opportunities for telehealth to expand.